So what we're going to do is try to simplify sacral diagnostics. There are multiple methods and approaches with respect to sacral diagnostics. One of the things that you want to know very straightforwardly is that the sacrum as a structure is not particularly good at moving itself. However, it is good at being moved. The vertebral column motion will move it, especially at L5S1, and then the hips will move it. There's multiple muscular connections between all of these structures, but the sacrum tends to be moved by the hip, and the pelvis, if you believe the pelvis moves in a particular way, tends to be moved by the back and the hip, and the sacrum tends to be moved by the back. So general assumptions, if you look at sacral testing, there is a standing flexion test. However, that one may be not showing you what you would want to know. The thing is that a seated flexion test, you don't have to pay attention to the innominate. You do not have to pay attention to the pelvis or the iliac crest. You understand that if somebody flexes forward until movement happens from the vertebral column into the sacrum, that both superior sacral poles should come posterior. Okay, so you can get rid of almost all the other stuff and just go to the superior sacral poles. You have to make some assumptions because when somebody is seated, the soft tissue will crowd the area. The PSIS can become harder to find, but not impossible. If you are inferior to the vertebral column and on something relatively firm in the middle, then you can assume that you are lateral to the midline on the sacrum, right? So I'm going to be careful that I don't come into here to get in the way, but essentially what I would do is I would use my thumbs, but in this case, I'll just use my my index and my middle finger on one hand. Okay, so first I'll identify. You agree that that's about superior sacral pole? Sure, she says sure. Fair enough. It's not absolutely sure, but your vertebrae would be up there. This is your sacrum. Yeah. Okay, so I'll have you tuck your chin, roll forward as best you can. Keep going, keep going, keep going. Okay, so now I should be able to push in on one side and push in on the other side, and they should be about the same. I'll use my thumbs because I trust them better. And the right one it stays posterior or comes posterior. The left one doesn't come posterior. Right? So I have now identified that I believe that there is something going on with the sacrum. Now, granted, if there is a problem with side bending or rotation of the vertebral column, I can't trust that because the problem could be that the movement is not being transmitted fully through the vertebral column. So just talking about the assumptions I have to deal with. So if there's no vertebral column problems and I find that, then I believe that's the sacrum. Right now, I don't know. Just trying to show you how to shortcut most of this testing. I'll have you on your stomach for a moment, if you would be so kind. Roll around to the other side. Thank you, thank you. Now, same fundamental assumption, but with the Sphinx test or with prone extension. I'm going to find the superior sacral poles or get relatively close to them, knowing that I'm not absolutely sure I'm on the exact structure I think I'm on, but I'm damn close. When she extends, I expect both to go down. If one stays back, it's doing wrong. So I'll stand on up. Right? Find the sacrum. You can see the high spot. Most pants will have a seam right in the midline. Find the high spot, kind of go in there on either side of the midline. Okay, come on up on your elbows as high as you can. Okay. And then interestingly, the left one stays back, right? So left one stayed back in both positions. Come on down, right? So for the purposes of assessment, I haven't checked the vertebral column, but I have seen two things in the sacrum. Regardless of the movement, the left stays back. I don't need the fancy terminology. I just need to know that I found that. Now, what I'm going to do here is just an overpressure test. Midline, recognizing that I am on one side, I'm going to try to be as over the midline as I can. I'm going to push down on one side of my hand. I'm going to push down on the other side of my hand. And it's tough to tell. Right, the right one feels like it yields. It may be the right one's more uncomfortable to you, right? So the right one is more uncomfortable to the patient. That is worth noting. But the one that won't move stays the left one, right? So I've got multiple findings. Kind of no matter what I do, that left side doesn't move. It doesn't do what I want it to do or what I would expect it to do in any circumstance. So now my focus is on that left one.